Hello, everyone. Welcome to the new podcast series, Health Warriors by Yobushu Cares. Here, we bring you the best health tech geniuses who have worked day and night to successfully challenge and change the health tech game for better. I'm Shivanshi Verma, co founder of Yobushu Cares, and your co host for this podcast today. Today, as a guest, we have Dr. Sumiti Saharan with us. Dr. Sumiti Saharan holds a PhD in neuroscience and STEM biology from Queensland University. She is the program director for Together for Her. So, Together for Her is India's largest B2C maternal health platform. Till date, they have helped more than 10 lakh women have a healthier pregnancy. At Together for Her, Dr. Sumiti is responsible for the discovery and the conceptualization of health solutions that can help women have a healthier pregnancy. She's an inspiration, and we are honored to have her as our guest for today's podcast. So, without any further delay, let's begin. Hi, Dr. Sumiti. Welcome here.
Hi, Shivanshi. How are you doing?
I'm doing good. How are you?
Good. It's been a good week so far. Better now that I'm talking to you.
That's pretty good to know. And today I'm so excited to have you here, and especially because, since our interests align a lot, you are also working in healthcare, and we also are working in healthcare. So I have a lot of questions to ask to you, right? So pretty much, I would just like to kick off with, asking you that what exactly inspired you to work on maternal health? It's a great work that you're doing it together for her, but what exactly got you here?
Sure. So I don't have one of those momentous, life-changing stories that a lot of startup founders have. For me, I've always been driven by discovery and innovation. I think that is what drove me towards science, and I found that in science in a lot of ways. I shifted to digital health when it was just an upcoming field. You could see digital technologies being used in other domains. And given that health was always something that interested me, I felt there is space for both discovery and innovation in this space to see how digital technologies can really marry into healthcare and make the healthcare delivery system a lot better. It really feels like there is so much scope for improvement, like when you look at how healthcare delivery is. So I made that shift over 6 years ago, Shivanshi, and then I have worked in different healthcare areas, from cardiac health to mental health to maternal health. And the idea was always trying to conceptualize solutions that really put people at the center of the solution and make a better healthcare journey. And maternal health started as a project, as one of the things I worked on. And for me, within healthcare, being a woman myself, women's health always mattered.
Right.
And I realized as I started working on the project and understanding the space that it's a very unique time, because it is a time in a woman's life when she does have unique healthcare needs. She needs support. She needs tremendous support.
Right.
Any benefit is doubled, right? It is transgenerational, because you not only help the woman, you also help the baby. And it is very different from any other health condition, that it is not a disease at all. It is such a positive experience. So I really found it more as a very strong entry point into women's health, where you can begin to empower women, change their healthcare journey, and support both the woman and the child. So that's been my rationale.
That's really great, how you transition from cardiac health to mental health to now maternal health. And in some way it's like shaping the future generation, right? Because it's usually said that a child health in the very first few months of his or her life influence their entire life. So I kind of really appreciate the work that you're doing. So Dr. Sumiti, you mentioned about transitioning to digital health. So how has that transition been for you? So, if you look at people, many people still are doubtful in going towards digital health. They prefer the personal one-to-one connection with the doctors. So, how do you think digital health is going to play a role here?
And that's what makes it so exciting. So I think if you look at the healthcare space in general, uh, it's always been about a decade behind other innovations being
Right.
incorporated, and in some ways for the right reasons, because when you look at healthcare, you're playing with people's lives. So
Right.
the industry is a lot more cautious about changing mechanisms, changing the way it operates. We have seen it in technological innovations, we have seen it in adaptability in various ways.
Mm-hmm.
And its relationship with digital technology is the same. Digital technologies have been fully incorporated into e-commerce, for example, right? It's really being leveraged. But when it comes to digital and health, there is acceptance at the device level, but it's a very nascent relationship. And right now, digital technologies are thought of as a good to have satellite. Oh, this is a nice, cute perk, a cherry that you put on the cake, but the main
Right.
substance is with the doctor. And in a way, it's true. But
Mm-hmm.
I do think there is this power to reimagine the whole healthcare delivery system, to reconstruct it in a way that really starts to work better for patients and works better for doctors. And digital is an amazing fulcrum there. So I do think the change will happen. I think I mean, I'm obviously biased here, but I do think you and I are in the space at the right time, because what we will see is slow adoption, but we have also seen how changes like COVID actually really, really accelerated this,
Right.
because it highlighted the need for an interface that sits outside a clinic. And it
Right.
really highlighted the power of digital technologies to create a seamless, holistic experience for people. So I think it's going to happen, and I think that change we are beginning to see. And I think how it can really be incorporated, I don't think we are done even imagining all the ways that it can improve healthcare delivery.
Right. And I like very much agree with you when you say that, COVID has highlighted the role of digital health, right? Because even if you look at the healthcare system of India,
Yeah.
right, there are so many less doctors as compared to number of patients or number of people who need the treatment, right? So we need something which is scalable enough, and uh, glad that a lot of digital health startups are now coming up with ways in every area. Um,
Way to us.
yeah. So, Dr. Sumiti, before this, like you have been in neuroscience for a long while, right? You did your PhDs and a lot of study in that area. So, how do you think that neuroscience plays a role when it comes to maternal health or healthcare in general?
So I think a lot of the role comes from the mindset, not from neuroscience. At a base level, I spoke to discovery and innovation. When you're a scientist of any kind, you you approach you approach problems with an air of curiosity. You don't settle for chalta hai, this is okay. You say,
Mhm.
how do I, what is the best, what is the right, correct way of doing this? What
Mhm.
is the outcome that you really want to drive? And you are very, very data driven. You kill your biases, you kill societal biases, and you really use data. And I think in healthcare, where right now nobody has really cracked it, both
Mhm.
in terms of a reimbursability model, I think globally it's a challenge, and in terms of really incorporating it into the healthcare system. So there's going to be a lot of failure, there's going to be a lot of trials, and there needs to be a mindset openness that is not biased by what we have seen around us, that this is the only way to do it. And I
Mhm.
think that, for me, I find very useful, the ability to imagine things differently.
Mhm.
The second layer where I think my background really has helped me is I've always been interested in behavioral neuroscience, right? And there
Mhm.
is an understanding as to why behaviors are different,
Mhm.
difficult for people to change, and
Mhm.
what are some of the mechanisms that can go in really rewiring our brain towards different
Mhm.
behaviors.
Mm-hmm.
When you look at any health condition, most health conditions have a patient side to it. There are things people can do to improve their quality of life, to reduce their symptoms, to maximize the chances that they have a positive health outcome. And all of that is behavior change. And
Right.
it's really, really difficult behavior change because health is boring, right?
Right.
Behavior change is hard. So you have a very difficult combination. And we do need all the tools we have at hand to really make those behavior change journeys easy, simple for people, palatable for people. And I think that background really helps me there.
Right, right. And like you said a very good point about behavior change here, right? The role which it has to play. Because even when we see our users, although we deal in different
Yeah.
space, we're mainly into weight loss, what we see now is that people don't like to be dictated, right? They don't want someone to come and tell them the rules which they have to follow. They want something which actually modifies their behavior in the long run. So, yeah, like great that you're leveraging that in maternal health aspect as well. So, Dr. Samiti, like, I'm just curious, like, since you have been helping millions of people now and in improving their maternal health journey, so what do you think is the biggest challenge which the maternal health industry faces as of now?
So I'll answer the question from first the healthcare industry point, because I think the challenge is not so unique to maternal health.
Mm-hmm.
It's also true, equally relevant for the obesity industry, right? It's equally relevant to most of the healthcare industry. And I am sort of contextualizing my answer to India. We do have a very unique healthcare ecosystem in India. I think there are the following challenges. One, we know that there is a lot of potential between data, digital technologies, to really drive seamless healthcare. Everyone recognizes it. But
Mm-hmm.
it is very, very hard to incorporate because of how entrenched the ecosystem is.
Right.
The second challenge that really exists is, while both patients and doctors want positive health outcomes, that's why doctors are in it, the way the ecosystem works, the priorities go in opposite direction. So there is an silent tug of war that happens between these two important stakeholders. And
Mm-hmm.
most of the solutions out there either try to solve for the doctor's problems or they're trying to solve for the patient's problems.
Mm-hmm.
And they pull the solutions in opposite directions.
Right.
Unless we are able to reimagine a system
Mm-hmm.
that really aligns a patient's interests with doctor's interests, it
Mm-hmm.
becomes very difficult. A very common issue discussed in maternal healthcare specifically is C-sections, right?
Mm-hmm.
That the rate of C-section is much higher than what it should be, and the issue is women obviously want a normal delivery. As much as possible, you should try and go for a normal delivery. Doctors are struggling with time. You spoke to the doctor to the patient ratio. When you have C-section, yes, you earn more money, but there's a financial incentive to go towards a C-section.
Right.
Even if you ignore the financial incentive, there is an incentive to save time and have predictability of routine. If you have a normal delivery, you have to get up at 3 a.m. If there's a C-section, you can plan it for 10 a.m. in the morning. So
Mm-hmm.
there are a lot of incentives which are pulling doctors the other way. And
Mm-hmm.
despite their best interest, sometimes it becomes very, very hard at scale. So
Right.
you need to create an ecosystem that actually incentivizes positive health outcomes for doctors, right? And it
Mm-hmm.
gives more power to patients to become knowledgeable and proactively manage their health. And that, I think, right now it's almost like they sit in opposite teams.
Right.
Both of them have the patient's best interests in mind
Right.
because the system is not supporting either party. So
Right.
that, I think, is a challenge we need to solve. And the second biggest challenge in digital healthcare is a reimbursability model. I
Mm-hmm.
think somebody needs to pay for these solutions if they have to scale. And that reimbursability model, and finding a reimbursability model that doesn't cause conflict of interest in terms of the impact that we are trying to drive,
Mm-hmm.
is a challenge that I think a lot of companies are trying, but it's yet to be cracked globally.
Right. And when you talk about doctors and the patients being in opposite parties, I do agree because I've seen that many times when a mother has to go for delivery, and if doctor advise C-section, even if it's needed, then people sometimes don't believe.
Yeah.
Okay, so there's a kind of disbelief which is running up in the
And,
system.
and then that rubs doctors the wrong way, right? Because
Right.
they're like, you don't know the medical side. And
Right.
from the mother's side, the doctors say, right now, if you wanted a normal delivery, there's a certain amount of healthcare you should have done, physical activity you should have done, managed your risk conditions. You've not managed all of that. I'm
Mhm.
not a magician here.
Right.
So it works both ways.
Right, right. I do agree with you. And when you say about, things that we need to keep in mind in order to have a normal delivery, so can you like just elaborate a little more on that? What a mother should do in the entire period of 9 months to have a healthy pregnancy.
So it actually ideally starts even before you conceive, right? Basically, there are very well identified risk conditions
Mm-hmm.
that increase the probability of complication. So for example, if you develop gestational diabetes, you are going to have complications. You will most likely have a preterm birth. If it's a preterm delivery, it will be a c-section. So
Mm-hmm.
there are all of those scenarios. So I think the biggest influencer is preventing pregnancy risk and managing pregnancy risk, which requires going to the doctors, adhering to the antenatal care pathway that is advised in terms of when to go to the doctor, when to get the checkups,
Mm-hmm.
which very often, except in the upper middle class, gets bypassed.
Right,
Remember, India is a very, very diverse country, and most pregnant women don't have access to the premium hospitals like Cloud9s where they will get top notch service.
right.
So there is just detecting and managing risk so you do not have those complications that will lead to a c-section. The
Mm-hmm.
second side is just sort of maintaining your physical fitness, right?
Mm-hmm.
And there your nutrition, your physical health all go hand in hand. If you have not built up your pelvic muscles, you're really going to struggle through normal delivery. And if it's a prolonged normal delivery, at some point your muscles are just not going to be able to support you. So
Right.
there is basic lifestyle. You really need to have your body at top notch health for yourself and your baby, and
Mm-hmm.
you really need to know the risk factors, avoid them, look out for danger signs. And right now there are a lot of drop off points, like
Mm-hmm.
a lot of pregnant women only go to the doctor after they have conceived,
Right.
instead of going earlier, making sure their body is at fit, good health before conceiving and then conceiving. They typically go to the doctor around the 10th to 12th week, not before that.
Mm-hmm.
Some of them will skip the sonography. Like the number of women that I speak to, you're in waiting rooms, they have no idea of the cost. And the doctor will say, you'll have the sonography, this is a charge, and you'll have the husband and wife discussing, okay, maybe we will get this test done, but we will skip this because it's a financial burden that they have not planned for.
Right.
All of these factors come in, and sometimes, unfortunately, they put the pregnancy journey at risk.
Right, right. And when you talk about the effect of physical health and what you're eating throughout the pregnancy, so do you also think that the mental health of the mother and how they're sleeping, does that also play a role in having a healthy pregnancy?
So, the short answer is definitely. The slightly long answer is my vision for healthcare is where mental health stops being treated as a separate branch.
Mm-hmm.
But I don't know a single health condition where there is no mental health component.
Right.
Mental health, maternal health, this makes a lot of sense from a medicine point of view. But when you
Mhm.
look at either, the biological perspective, or when you look at from a human being's perspective, all of us want to feel and be healthy. We want to feel like we can fully enjoy life, and just feel healthy. And that feeling and being healthy is connected to us feeling physically fine and mentally fine.
Right.
And our brain and our other bodily organs have very strong interrelationships, right? This has now been proven in so much literature that it's becoming more and more detrimental when you think of healthcare delivery, when these things are treated separately. um, Pregnancy, how you're feeling, stress, to your physiological reactions, to inflammatory pathway, all of these components are extremely connected. And
Mm-hmm.
it is very, very hard to solve for one unless you stop looking at a person as just parts, and start considering them as human beings who need a healthy body and mind.
Right. And like you rightly said that these two things are very related. In fact, I even believe that mental and physical health are related with each other. So
Of
when I
course.
talk, yeah, when I talk to a lot of people on a daily basis and they come up with problem like, emotional eating or eating when they're bored, right? So that's indirectly a mental health problem. They're not able to manage emotion in a good way, and that's why they're eating. And that's leading to weight gain and other physical health issues. So yeah, like you rightly said, that we can't separate these two things. And happily, you are also taking care of that and together for her.
Yeah,
Yeah,
we want to do a lot more, but the intent is there.
yeah. I think that intent is a like a very good start, and I'm sure that after helping 1 million people already, you'll go there. So, Dr. Sumiti, we talked a lot about what things people should keep in mind while their pregnancy is going on, right? And you also touched upon their health before conceiving,
Mhm.
right? So, how do you think that let's say if we talk about weight or if we talk about obesity before pregnancy, how do you think that plays a role in affecting their pregnancy moving forward?
Yeah, it plays a very clear role, right? And it's very well proven. Unfortunately, there are these myths around pregnancy, right? Pregnancy is this time jahan jo khana hai khao, eat whatever you want to, you gain weight, you have to eat for two. And
Um,
some of these notions have really gotten misinterpreted. So you see these mother-in-laws like just out of really good intent, every hour giving a milkshake
right.
to drink. And the concept in pregnancy, there are two. You need to be the right weight when you start your pregnancy. If you're underweight or if you're overweight, your chances of a risky pregnancy are higher. One, during pregnancy or weight gain, there is a very well characterized graph of how the weight should increase over the months, and you really need to stay within
Mhm.
that range. Because when you have too much or too little weight gain, not only does it affect your physiology, remember the baby is taking all of this nutrition from you, it is affecting the baby's development, both in terms of the baby's weight, growth of organs, growth of the brain, but also the baby's cognition. So it's a lot more about the quality of food than the quantity of food.
Mhm.
uh, in your first and second trimester, the amount of food doesn't really have to change dramatically. Like the calorie change is, it's just a slight delta. What you
Mhm.
have to do is be a lot more careful about nutrients. What are the nutrients going in the body? Because different nutrients are response supporting different organ development. And
Mhm.
it's that nuanced understanding which obviously is difficult for somebody who has no background in science to grasp, right? And who
Right.
doesn't know the name of nutrients, who's like, okay, whatever is being cooked at home, I eat that and I eat a lot of it.
Right. Yeah. Yeah. So I think like I have heard many people say that, you eat whatever you want. So I kind of relate with that because people really do have this notion that they can eat anything under the earth during their pregnancy. But yeah, thanks for clarifying it for our audience. So, Sumiti, we talked a lot about, the health of the mother, But how do you think the paternal health before conceiving also plays a role? Like, does it play any role? And if yes, what's that role?
Um, before conceiving, you're saying?
Yeah, before
I
conceiving.
I mean, it's a little more distant. Obviously, the woman's body, because that sort of the body that incubates the baby has a much more direct impact. Paternal health only plays a role in terms of sperm health, is where
Mm-hmm.
I would call it out. That's where the biggest influence comes through, right? So
Mm-hmm.
it's a little bit more distant,
Mm-hmm.
as much as I know. Uh,
Mm-hmm.
yeah.
Yeah. Okay. Okay. And like Dr. Sumiti, what do you think is how the the relationship with the partner, right? Sometimes some people are supportive, sometimes they're not. So how does that affect the health of a mother?
Yeah, it's a time when the relationship really changes, because on, during pregnancy, obviously your hormones change a lot. So a lot of women, first of all, it's such a huge event in life, and you're obviously feeling very logical excitement, but also anxiety.
Right.
Your identity as a woman is going to entirely change. You will have an identity of a mother, and it's a brand new identity to adopt. You worry about how that's going to play with your other identities, your professional identity, yourself, your wife identity, all of those. So it's a huge transition in a life, and the hormones don't make it easy on a woman. So you have hormonal changes that are making her feel irritated, moody, really anxious, and
Mhm.
really wanting support.
Right.
um, and it's very very hard. So unfortunately, I mean, there are the traditional Indian family says, oh, this is the woman's world, right? I
Mhm.
have nothing to do with it.
Right.
um, and there, I mean, traditionally women then seek other people in the family to find support on, and very often they will get support in terms of what to eat and all of that, but they struggle to find emotional support. Even when husbands do want to support, they struggle because they don't understand what is happening. They are like, why is she behaving like this? So you
Right.
see a lot of probability for conflict arising. You see a lot of women seeking support. It's one of the reasons women will really reach out to other pregnant women just to find somebody who's undergoing the same experience, even if
Mhm.
they haven't been the best of friends. Uh,
Mhm.
Definitely, every time we have spoken to women, it's a need that comes up.
Mhm.
Their fundamental needs are, I need to know what to do. I have so many questions. When I have these questions, can somebody give me an answer which is
Mhm.
reliable? Because you're always nervous. It's such a responsibility. Can I do this? Will this harm my baby? Oh, I'm feeling this. Is it okay? Should I do and go to the doctor? All of those questions. And then
Right.
the second is emotional support. These
Mhm.
are the two, I would say, biggest unmet needs that come in this space when you talk to users.
Right, right. So, yeah, like that's very right because when it comes to support, there's a lot of support available in terms of what to eat, what not to do. But when it comes to their own mental health, I think that's where they need someone to support them. So, yeah, thanks for answering this, Dr. Sumiti. So, like, next, I would like to ask you that, like, since you are dealing with so many women on a daily basis, so what do you think is the biggest challenge together for her is facing now in reaching to the tier three or tier two audience?
Uh, in reaching specifically, I think so. Since we are a digital app, obviously our scope of reach is to people who have access to a smartphone, either she or her husband. Uh,
Right.
we have good reach in tier 2 and tier 3. The challenge is when you look at new internet users. So these are people who have adopted smartphone recently, have a very different expectation in terms of what the product, how to use the product, probably only use WhatsApp on the smartphone and nothing else.
Mm-hmm.
um, there is a steep learning curve.
Right.
There is a strong mistrust of this digital space. It's like this, what is happening?
Right.
So both in terms of the user experience as well as in terms of the content, you need to be extremely sensitive to the fact that the priorities of these new internet users are different. Their digital use behaviors are different. So just designing an app with best practices, or testing it within the office team, really
Mhm.
doesn't work out.
Right.
We have to actively make sure that, yes, we test it with some working women who are very well educated, but we also test it with women who fall in the description of a new internet user, don't
Mhm.
have as much literacy,
Mhm.
don't have as much empowerment. Typically, the phone is with the husband. Uh,
Mhm.
and the husband will come back from work, and that's when the woman will take the phone around 9
Right.
p.m. in the evening,
Mhm.
use it to do a WhatsApp chat, and then quickly look at together for her. So
Mhm.
everything, like when you send the notifications, how that content comes, recognizing that there'll be a TV playing, there's another kid screaming, they're probably not going to be able to listen to the audio. All of that needs to be built in into the product design, so you are as accessible to the user as possible.
Mhm. Mhm.
So that,
Right.
I think, is the one challenge, uh, to constantly curate an experience that is inclusive of people who haven't had the same privileges, the same exposure to both literacy and the digital space as some of the urban sector users have.
Right, exactly. And like you rightly said, that uh, the audience group is like quite diverse. On one hand, there are people who are actively looking for such things, right? They want to know what's coming up, how's the baby growing. And then there are people who are not aware about how things work. So, but glad that you are trying it for, both these groups, and you are addressing everyone in
One
that.
thing I'll say is, but it's extremely full, because the power of how much value a product like ours brings for a user who is not going to like a really good hospital and doesn't have access to other pieces of information is much
Mhm.
higher. So you see it in their retention numbers, you see it in their engagement and feedback, like how much value they draw from those videos uh,
Mhm.
is also much higher, because they will struggle. Other than Together for Her, the number of alternatives available to them are fewer than
Mhm.
somebody who already has sort of like a maternity clinic with a good experience and is getting guidance.
Mhm.
So it
Right.
goes both ways.
Right. Glad, like, I really, appreciate the impact that which you guys are making. And I think that it has a huge role to play moving forward. So, Dr. Sumiti, I would just like to, end this podcast with one last question, which is that what tip would you like to give to our future parents?
Our future parents,
Yeah.
uh, I I mean, this one part of me just wants to say enjoy the journey. But more than that, I do hope that they recognize that it is their health, and the power to manage both their health and their child's health
Right.
sits in their hands. Yes, they need the expertise of a doctor. Yes, they will need a hospital for the delivery. But a lot of health happens at home.
Right.
And that power to manage health is with them. And the second thing is, you know people get paranoid about, how do I give my baby a right head start, finding the right preschool, and there's so much effort that parents put there.
Mm-hmm.
Best head start for a baby is a healthy body and a happy mind, and a lot of that comes from the nutrition, the lifestyle that a mother has. And I think people recognize that, okay, what I'm eating might help, will influence the weight of my baby at birth, but it goes much further.
Right.
If a woman is anemic, it can have cognitive implications on the baby for the rest of the baby's life. So the best start you can give to your baby is proactively looking out for your physical and mental health during your pregnancy. And
Right.
the baby will figure out the rest of life. Don't worry about it.
That's like really great advice, Dr. Sumiti. And with this, I'm done. And thank you so much for all the information and everything which you shared with us today. And I really hope that the future parents are looking at it and they get benefited from it. So thank you so much for your
Thank you
time.
so much, Shivanshi.
Thank you.
All the best
Yeah.
also to your startup. It was lovely, lovely talking to you. Thank you for giving me the opportunity. It's just fun to share our learnings and experiences.
Yeah,
Thank you.
like it's been equally fun for me as well, and I myself got to learn a lot from this podcast today. So thank you so much.
Thank you.